Hey there, I'd just like to ask before the video starts, if you like what you see, please give us a click on the like and subscribe buttons. Hi everybody, I'm Karl Wells and welcome to Point to Point. My guest today is the president and CEO of PhoneMed. Now, if you haven't heard of PhoneMed, it's a company which provides healthcare information to clients over the phone. And they actually are operating in several countries right now. My guest started out, though, in healthcare, providing personal care to vulnerable senior citizens, and eventually became a nurse, and later on became the head of this company, which today is literally providing healthcare information to millions of people, and many of these people are people who otherwise would not have access to this kind of healthcare information. So it's a very interesting story, very important story, and I'm delighted to welcome Charlene Brophy to the program.
Thanks, Karl. I'm delighted to be here.
Welcome. Now, I assume you're a St. John's girl. Did you grow up here?
No, I'm a Bay girl. I grew up in a small town called Fonemed on the southern shore in the Irish Loop.
Okay.
Yeah,
well,
and if you listen to me for a few more minutes, you'll hear the accent come out.
Yes,
so it'll be pretty apparent.
Yeah. And I've often told people, if you go to the Irish Loop, sometimes you'll think you're in Ireland.
Yes, no question.
Yeah. So what was it like growing up there?
You know, I was so fortunate, and I say all the time that I won the lotto because of the family I was born into and the community I grew up in and so on. And it's not a lotto of wealth and riches, it's a lotto of love and life experiences and so on. So I have 5 siblings, and growing up in Fonemed, my mother was a stay-at-home mom. My dad was a plant manager at the local fish plant, which was Bonavista Cold Storage way back then. And I had extended family. My grandmother and my step-grandmother and my grandfather lived with us. And my dad was also mayor of our small town. So because he was mayor of the small town, there were people coming through our houses constantly. There was no Airbnbs back then. So, you know, as mayor, there was a concern that we were having trouble bringing teachers into the community, for example. And so we had to go outside the community and outside the area to, you know, retain teachers. And then there was nowhere for them to stay. So, of course, they moved into our house. So we had 2 teachers living with us at any given time in the community. And then if any, you know, repair people needed to come through for repairs on the fish plant and so on, they found a bed in our house too. I'm not sure where they all stayed, but there was always room. So we grew up in a family that was used to people coming and going, and people who were either in need in some way or serving the needs of the community. So it was, you know, it was an experience that I'll look back on now that I couldn't have imagined living a different life or having the start in life that I had that could possibly be any better to prepare me for where I've come today.
I have to ask you now about what your school years were like. I mean, did you have some of your teachers actually living in your house?
You know, by the time that I went to school, or that I recall going to school, they had moved on.
Okay.
And we had built on an attachment to the priest's house, so it was a second dwelling, and that's where the teachers then stayed when they came into the community. And then, of course, as you know, as education became more widely available, a lot of local, you know, students would go on and do their education degrees and so on. So we were able to, you know, bring a lot of local teachers into the area.
So did you enjoy school? What were some of your favorite subjects, for example?
Well, I enjoyed the socialization. I'm not saying I was a perfect student by no means, but I'm a very social being. So I always love the experience of being around people and the camaraderie that goes along with that and friendship and so on. So I never hated school because of that, because I love that socialization, but not because of the studies. If I had to tell you a favorite subject, maybe economics, which is funny, looking back now, and certainly anything related to healthcare would certainly have been of interest to me. In biology back then, and specifically, would have been the subject that interested me as well.
Yeah, I was going to ask, what was it that sort of tweaked your interest in healthcare?
Well, you got to remember now that goes back to where I grew up. So as a girl growing up in an Irish Catholic family, you really had three choices after high school. You could become a teacher, you could become a nurse, or you could become a secretary. And that was really the only options available to us.
And that's the way it was for a long time.
So I chose nursing. And I started off, actually initially, wasn't really sure that's what I wanted to do. So I did it was a licensed practical nursing course back then. I've
heard of that.
At the College of Trades and Technology on Topsail Road. So left home at 17, lived in a boarding house in St. John's, completed that program, and then worked as, while I was doing as a personal care attendant, and then after the fact at Hoyles Escazone as an LPN, and really enjoyed those years, but I enjoyed it so much that I wanted more, I guess. And I remember I had a head nurse back then, and her name was Maisie 80, and to this day I don't know, where she is or if she's still living, and I certainly hope she is, because she came one day and said, "Charlene, have you ever thought about doing more? Because you can do more if you want to do more." And that was kind of the inspiration for going on. And I went on and went to St. Clair's and did my RN. And then after that, moved away to Toronto for a few years, like many Newfoundlanders, but always come back. So that was my very humble beginnings.
So what was it like training at St. Clair's? I know my sister trained at the General.
Oh, yeah.
And I know people have trained at the Grace. What was St. Clair's like? Were they all pretty much the same in terms of
I think St. Clair's would have been a little more rigid because we lived at Littledale, which was run by the nuns, of course. So we had very strict rules. Everybody had to be in bed with lights off at 11 p.m. And then we had house mothers who would come and actually walk into the room and shine the light on each of us to make sure we were in bed and up to no good and so on. So it was very regimented back then, which was in actual fact, looking back, really good, because the nursing program, even today, is not an easy program to complete. So the studies involved are still great, and were great then and still are. So because we were so regimented, we didn't get up to no good, because we had to be home early, we had to be in bed early, and the program itself was so intense that it required so much studying that once I made up my mind to do it, I was determined not to disappoint my parents. And
so,
I would complete it.
How did the move to the United States come about? Because you moved to the States, right?
I did. So what happened is I left Newfoundland, moved to Ontario, came back, settled into Newfoundland, and was married at that time. And my former husband had an opportunity to move to Toronto for a position. So we moved, 3 young children at the time, and we moved to Toronto. And because I had to do so, I had to leave my job at the health science. So I was a nurse at the health science then for many years, 11 years in the burn unit, and I loved every minute of it. But I had to walk away from my pension and everything because of the move. And then when I was coming back, there was this brand new company starting up in Newfoundland called PhoneMed. And it was a virtual care company, which was unknown to anybody, back then. And I was like, well, what the heck is this all about? So that was back in probably 99, 2000. So I decided when I came back to take a chance, and I joined the company. And
so just, so where did PhoneMed start?
Right here.
Right here?
Yeah, so we had an office in the Fortis building. We shared space with AT&T back then, so there were all American investors back then.
Okay, I understand now.
Yeah.
So you weren't in on founding the company?
No, I joined as the company was founding, as the company was starting. I joined. So they had just gone out with an ad to hire a registered nurse and so on. So I joined then, and we really didn't have any clients in the beginning. And then, we managed to bring on a small client in Southern Oregon, and they were a hospital that was closing because they couldn't find physicians. So they put a phone in the entranceway of this hospital. If a patient got sick in this small rural community, they would come in at night, pick up the phone, and the call would come through to our call center here in St. Anthony, Newfoundland. And then we would answer that phone call. The nurses, we would triage the patient, and if it was determined they needed to see a doctor or have lab work or radiology ordered, then we'd call in the appropriate resources, and that was our very humble beginning. So after about
So when you started with PhoneMed, what position did you take?
a registered nurse on the phone. I was a triage
Oh,
nurse.
so you were on the phone?
I was. Yeah, I was
Okay.
answering calls. So within
And
about
they didn't have any clients in Newfoundland?
none. We didn't have any clients in Canada for our first 10 years of existence. We only had U.S. clients
For 10 years?
for 10 years. And we started in Newfoundland because it was way cheaper to pay Canadian nurses than U.S. nurses.
Oh, okay.
And back then, there were none of the regulatory challenges with licensure like there is today. As long as you were a registered nurse living and licensed in any province, in any state, you could provide clinical services. So, you know, we had, as I said, very humble beginnings, but about a year and a half in, our investors were getting very antsy. There was very little money coming in. There was 7 nurses then at the time, and we had 1 IT support person, and we simply couldn't afford to keep going, to keep, you know, paying everybody. So I really, from the day one, when I learned of this formation of this company and what we could do with it, I believed in it, because I had witnessed firsthand over my years working as a bedside nurse the difficulty in accessing healthcare. And I just thought, this is going to be the future. And I really did. I walked in and I thought, oh, we can really go somewhere with this. So I went to the investors and I offered, in lieu of continuing to take salary, I would take some ownership in the company. And then anyone who, you know, has run a business or owns a company will tell you, once you got some skin in the game, everything changes. So I worked 2 other jobs. So I had 3 jobs at any given time just to help support my family. Would work all day at this at PhoneMed, and then work either at the Health Science or at Canadian Blood Services. I did shifts as well, just to help to keep the lights on at home, and gradually started to build up the company. And I did so by going out to this small number of clients we had and said, we will offer you services for free for 3 to 6 months if you will introduce us to another client who signs on with us. Because we had to keep the nurses to provide the services available 24/7 anyway, so it kind of just made sense. And slowly we started to grow. And then when one of our clients we had brought on at that point was Beth Israel Medical Center in New York City. So when 9/11 happened and the second plane hit, because that was one of our clients, they called and said, we're sending all calls to you, send nobody to the emergency room unless it's life or limb. So, you know, we all, you know, everybody worked 24-hour shifts just waiting for all the calls to come. And the calls did come, but not from injured people for obvious reasons, from family members or firefighters' wives who said, I can't reach my husband. This, you know, the towers were down, the cell towers. Can you try to reach them, and so on. So we were receiving so many calls from people looking for family members, or saying things like, you know, my apartment is filled with smoke. Should I leave? What should I do? And at this time, we had no idea what, it was still unfolding. So we basically said, stay where you are, turn out your lights, you know, turn off your air conditioning units and stay close to the floor, basically, and just wait for further instructions. But we were, you know, because we were pivotal in just helping that Beth Israel Medical Center prepare for what could have been an influx of patients, which sadly wasn't. We received some recognition from the city. And all of a sudden, things started to change because our name got out there. Well, PhoneMed does virtual care services. And we brought on other clients in New York State, some of who were pretty well established, who were looking for remote patients to monitor, or nurses to monitor their patients remotely, patients who were on biometric devices, for example, oxygen saturation machines or blood glucose monitors and so on. And they, you know, they were looking for nurses to be able to manage that care after hours.
So at what point did you realize, and I assume you were one of the people on the phone, at what point did you realize how major this incident was? How big?
Well, you know, it's funny because I was on the phone at that time. Even though I had moved into a managerial role, we didn't have enough money to be able to pay managers, so I still took frontline calls. And I remember, like yesterday, our IT staff member coming out saying, quick, turn on the TV, something is happening in New York City. And, you know, we turned on the TV just as the second plane hit. And the moment the second plane hit, within seconds our phone rang, and that's when it was Beth Israel saying, so it was.
You didn't have the Beth Israel contract?
We did. We already had it.
You already had it in place?
We did, but only for the pediatric practice.
Okay.
Not for the emergency department, only for the pediatric emergency department. So we took all calls that came into emergency department. And because no calls could get through to their direct phones, but they couldn't reach us for some reason because of the way the towers were connected and so on.
So at that time, did you only have a call center here in St. John's?
That was it. Yeah.
Okay. Because initially you said something about St. Anthony.
We still have the St. Anthony site today. So, you know, you got to remember, nobody worked virtually then. It was in call centers, and we always needed redundancy. So the contact center in St. Anthony provided that for us, and it still does today. And then many years later, we took over the 811 health line in the province, which we still run today.
Right.
And, you know, we made the redundancy even early on for the province was important with the St. Anthony site. We had a site in Stephenville. We still got a big site, a major site in Corner Brook, where most of our nurses are located that run the provincial health line and so on. So that's still really important to us today, even though for the most part, everybody works remotely. All clinical staff and frontline staff work remotely.
So what are the range of services that you provide?
So if
you have a contract, say, with a municipality or
we do. So in Newfoundland,
whatever.
on the Canadian side, of course, you know, we run the 811 line in the province. So anybody that needs health advice calls 811, and we back end that with the service. We also run the mental health crisis line and various other service lines in the province today. So people may not know they're calling PhoneMed when they call 811, but it's our staff that are back ending that with service. And a number of years ago, we determined that we couldn't continue to grow with the platform we were using. So we basically outsourced, you know, just licensed a platform, somebody else's platform, like an electronic health record, if you would, to run our programs. So very last minute learned there was some ACOA funding available for companies that were looking to grow their, you know, technology footprints. So I applied for that ACOA funding, was successful in getting $2.5 million, and hired a team of software engineers and developed our own platform to run all of our clinical programs. So all of a sudden we spun from being a clinical company to a software company, a technology company as well. So today we not only use that technology to run our operations, we license that to companies all over the world as well. And so our Canadian footprint, in addition to Newfoundland, which I've talked about, province of Ontario uses our platform to run their 811 line, the province of Saskatchewan uses it to run their 811 health line, and we also run the 811 health line and the mental health crisis line for the Northwest Territories as well. So that's for the most part the Canadian footprint. The bulk of our business today is still in the U.S. So we've got clients in every state throughout the U.S., and we've got nurses living and licensed in every state throughout the U.S. as well. So we manage roughly about 100,000 patient visits every month. So it's a pretty busy operation, and it's not just for 811 advice, like somebody got a headache and what do I do to treat it and so on. You know, in addition to the mental health crisis piece, we do a lot of that, but we run, for example, sexual assault hotlines for about 150 universities in the U.S., or provide clinical services to student health centers for those same universities. We've got some very large hospital systems right from California to New York State that we run their programs, their clinical programs, either through outpatient clinic type of programs. We've got, you know, several community health clinics, through rural clinics throughout the U.S. that use our services to manage their patient population. And then we run specialty programs, like with municipalities, as you just mentioned. We run blood and body fluid exposure guidelines. So, for example, if a firefighter in Florida walks into a burning building and is exposed to unknown chemicals, they will basically call us. We will do a risk assessment and determine, you know, what they've been exposed to, what the building was, and what follow-up is needed, and so on. So we run a lot of specialty programs too. And then we've got patients on biometric devices right throughout the U.S. Patients that are diabetic.
Just explain what that means.
So that is devices, whether it's just imagine a patient has been diagnosed with diabetes and are monitoring their blood sugar levels, or a patient who's got COPD, like lung disease, are checking their oxygen levels and so on. we've got their devices integrated with our technology. So if we've determined at what level does the patient's blood sugar or oxygen saturation level sit, if it exceeds those limits, then we receive an alert right directly into our callback queue, and a nurse living and licensed in whatever state that patient is located will reach out to the patient, complete an assessment, and determine what next step is. It may be something as simple as to recommend adjusting the oxygen levels, or it may be reaching out to a physician and getting some orders for some medication. For example, if it's a heart failure patient who's gaining weight and is more short of breath and may need a diuretic and so on.
Apart from the people who are on the phones, what other kinds of employees would you have? I assume a lot of the things that you have done for you are done on a contract basis with.
No, all of our staff are employees that we don't. We
What about
don't,
software development?
So we've got maybe 8 or 9 software developers on our team. We've got multiple software support because we've had significant success in licensing our technology. So back in the early days, we licensed it in Bangladesh and Greece and Manila and the Philippines and so on. Still have a very large presence throughout the U.S. and Canada, and installed our first site in Singapore 2 years ago, and about to open up another site in Singapore as well, and pursuing an opportunity in Saudi Arabia right now as well. So we've had significant success. So because of that success in the technology, we require significant support when it comes to the technology infrastructure and so on.
And are most of these people based here in the province, or what do you have in Ventura, California?
Yeah, so Ventura, California is the sales office for the most part. So we've got some large hospital systems in California, so I often meet with clients there or potential clients and so on at our Ventura, California site. But for the most part, all of the executive team is located right here in Newfoundland, and most of the agents that we've got, healthcare navigators, maybe 100 plus healthcare navigators who answer most of the calls. The bulk of them are located in Newfoundland as well. And then of course with the Canadian-US regulatory challenges these days, we've got nurses on the Canadian side in every province throughout Canada and in every state throughout the US. What really changed for us, and I'm fast forwarding the story here, is when the pandemic hit. Because we were very well positioned, because this was our bread and butter anyway. This is what we did, virtual care. So we were very well positioned to respond to the changing need and the demand for care. I can't even begin to tell you how it grew overnight in Newfoundland, and you just imagine how that was exacerbated on the U.S. side and how we had to respond.
Internationally,
really. Yeah. With the technology piece, there was a huge demand to increase that footprint. But on the provincial side here in Newfoundland, the problem was access to care, and patients couldn't see their physicians. They couldn't get prescriptions refilled. Urinary tract infections that could turn into sepsis and a really serious condition were left untreated for many patients, because even if they could go to the emergency room, they were afraid because they didn't want to be exposed to COVID. So we worked with the province and started a program where we hired nurse practitioners. So started off very slowly with a nurse practitioner, and then 2 and 3 and so on, and grew that program significantly, so that today we've got about 70 nurse practitioners licensed right throughout Canada, providing services right for patients right here in Newfoundland. And so we diagnose.
Are these full-time workers or part-time?
No, they're part-time workers. Many of them, of course, with the nurse practitioners, they need to keep up their licensure as well. Yeah. Many of them work full-time.
They commit to do so many hours a week or whatever.
Absolutely right. And it's not only over the phone and listening to a patient talk about their symptoms. We've integrated our technology with video cameras, so we can do video conferences. All of our clinical staff can communicate through chat and video nowadays. The younger generation don't want to phone a nurse, they want to chat with a nurse and be assessed and so on. And then we moved forward from that with integrating the technology with various emergency rooms throughout the province. So today we manage, I guess, about 6 emergency departments in Newfoundland and Labrador, rural hospitals, where our nurse practitioners are available. If a patient walks into one of those emergency rooms, then if they're determined to be non-emergent, that require hands-on care, they're offered the opportunity for a virtual appointment. So one of our nurse practitioners assesses this patient remotely and can look down ears and look down throats and listen to lung sounds remote. It's a pretty amazing program.
And it sounds to me like you, well, it's obvious to me that you're a world leader in this type of technology, this service. Do you have any competition at all?
Oh my gosh, yes. There's competition everywhere. I mean, on the Canadian side, there's a couple of players certainly, but on the U.S. side, there's more. And it's interesting because during the pandemic, a lot of new competitors popped up, and many of them are still mom and pop shop type of operations. But you know, it's raised the awareness of we always need to be cautious and make sure that we're, you know, remaining efficient in all operational processes and procedures and so on. So there's been so many opportunities that came from the pandemic, not only for additional work for the organization, but for additional opportunities for us to stand back as well.
So Charlene, are you now like the main stakeholder in PhoneMed?
Yeah, so interestingly enough, we 2 years ago, 2.5 years ago, I guess now, we had brought in a partner about 5 years earlier than that, St. Elizabeth Healthcare. You may be familiar with them, based in Ontario. They're one of the largest home health providers in the country. And we were working with them on a potential opportunity in Ontario. So they bought into the company, invested, and acquired 20% ownership. And about 2.5 years ago, the remaining shareholders in the U.S. were aging. Many of them were in their late 70s, 80s, even into their 90s. And we're looking forward to reap the rewards after all these years, as you can well imagine, because, you know, in the early days when we had no business and had to continue to pay salaries, all of us were challenged, and, you know, it was very, very difficult for them at the beginning as well. So they've reaped the rewards, and we sold the remaining 80% to SE Healthcare as well. So today, even though I continue to run the operation and we operate, you know, still autonomously for sure, the parent organization is SE Healthcare, and they have been the most phenomenal partner ever. And it was a good relationship, because you can only imagine when you look at the needs in our community today for that continuum of care, right from somebody who's, you know, dealing with an acute healthcare issue to when they're hospitalized and then get them back home and provide the in-home care they need. The relationship has made perfect sense, and it's allowed us to grow significantly.
Charlene, thanks so much for being on the program and telling us your story and the story of PhoneMed. It's been fascinating, and you've been a delightful guest. Thank you.
Glad to do so. Thanks. Great chatting to you.
And we'll see you again next time.